Well, the consequences are that sometimes depending on the site of the ulcer, that's also very important. Now, if you particularly get a tiny injury at the tip of a toe, particularly the great toe, which bears the most of the sort of, if you study the human biomechanics, when you walk, you put the heel down, then the fifth toe, then you transmit the weight onto the big toe, and the big toe will propel you in. Therefore, there are certain areas you apply more pressure underneath the sole. So those are the areas that you are very, very much vulnerable to develop callosities.
I see.
And then unless you take care of those areas, you are prone to get an injury. So other commonest reasons for injuries are
actually they don't wear proper shoes, and they get shoe cuts.
Right.
Then of course by going to cut their toenails, they get themselves injured, and sometimes the rats come and bite them during the night. Then of course the foreign body injury, like they will just walk on a nail or some other foreign object where they have piece of broken glasses, and they can get themselves injured. Then of course thermal injuries, because they have loss of sensation. They will be going to temple without shoes. Usually we go to temple without shoes.
That's correct.
When very hot, when you walk on a very hot sand, because temple has a lot of sand all over the place, and during the daytime, if you just walk on the sand, they will get thermal injuries and they get burns without their knowledge. And of course the chemical injuries, like they will put the various things like phenol and various other things when they go to wash their toilets and all that. Probably due to those things also they can get injuries, but they are painless, so they will just ignore the injury and probably put some home remedies, and they will end up in severe food problems.
Right, so
and
this
infection.
can happen, this can happen anywhere. If you just walk barefoot, it can happen anywhere. Let's get into detail about that once we go into a break with MTV Sports Good Morning Sri Lanka. But do visit our Facebook page on www.facebook.com/Good Morning Sri Lanka. Click the like button and stand a chance to win merchandise by MTV. We'll go into a quick commercial break and we'll be right back.
And of course, we here on Good Morning Sri Lanka want to give you some awareness and you some information that can really help you improve the quality of your life. And since diabetes is an extremely prevalent disease here in Sri Lanka, we have with us two experts on the subject who are here to speak to us about a particular ailment that can develop due to diabetes, which is diabetic foot disease. So doctor, now we spoke before the break about the types of injuries that can occur in your feet and things like, and how these ulcers and these external injuries can develop. Now let's speak about what the patient can do once they have detected these wounds. So if we speak about your role, the doctor's role, the general practitioner's role when it comes to after detecting these wounds, where do you come in?
Well, all these, we have in Sri Lanka, we are very fortunate. We have a very good health system in this country, from primary care to the tertiary care. So we have a lot of very educated and very caring GPs all over the island. So they are all geared to sort of help these patients. And we do have vascular surgeons, neurosurgeons, all those orthopedic surgeons. Actually, our health system is in par with any developed country. So it is the problem here that the people, since due to the poor awareness among the people, they don't reach these specialties at the correct time. That is the problem. They, as Dr. Jayama told you earlier, they take their own home remedies. When the things are getting out of control only, they reach the doctor. By then, it may be too late.
Of course.
That is the very reason why people undergo amputation. They go to hospitals or the surgeon or your GP at the later stage, because while trying all the other home remedies, then they go. Because the reason is that they are not bothered. Now, if you have a pain is the one which drives a person to seek medical advice. Since you have no pain,
they
don't complain, they don't go to seek proper care.
So what are these incorrect, if I could interrupt you for a second, what are the incorrect home remedies that people are using nowadays to treat these injuries?
Various things, from petrol, kerosene oil, brake oil, to various other.
They put shunam,
I don't know,
beetle too, and various
unbelievable things that they use sometimes.
Oh, I see.
Then there are various kind of Ayurvedic treatment, or maybe certain pepper leaves, or I sometimes
The list goes
also
on.
get confused of why people use these.
Right.
Well, then what happens is that the things are getting hot. They go to take antibiotics. They go to the nearest pharmacy and get some ampicillin, cloxacillin, or whatever. Try that out also well. So these are the things that delays the infection. Then only when they get the fever with shivering and sore and leg, then they rush to a doctor. By then it may be too late.
Be too late, of
Right.
course.
So therefore, from the beginning, since you know that you are a diabetic patient, the moment you get a foot injury, you must immediately seek the advice of the doctor close by, a proper qualified doctor. All the government all the government hospitals in OPD, whatever the rural hospital, you have the facilities to attend to these needs.
And we do have the necessary resources in Sri Lanka to have
Definitely,
both,
yes, we
all
have
of this.
abundant resources.
It's just the
unfortunately,
awareness
it's
that is not
properly
I see.
utilized. The reason is that now, as I told you, 3% of the diabetic patients do have vasculopathy. That means they don't get enough blood to the leg. Sometimes improper bandaging systems. Sometimes you might put a tight bandage around your toe or around your foot.
Right.
The following day, it's gangrenous, black color. You have to invariably have to amputate it.
Right.
Sometimes even the primary healthcare worker might not detect that problem. So it is just merely taking the pulse of the patient, you can detect. That's a very simple thing. Even to detect neuropathy, there are certain small gadgets that we will show you later called monofilament.
Okay.
If you reach your DP, this Hiria, commonly known as,
Right.
or what we call paresthesia, is a very common thing. People call for Hiria for various things.
Yes.
And they take things for granted. And now we have certain electronic apparatus called like biothusal meters to get some value to this Hiria. And at certain stage you can't do anything. Then your leg is totally gone,
Right.
and you become insensitive to anything. Then if such a patient develop vasculopathy, that will lack of blood to the leg,
Right.
things become very bad.
Yeah.
Immediately within few days or maybe 1 or 2 days, we might have to amputate the leg. If we don't amputate, that patient will surely die.
Right.
So
Oh,
those are the implications.
So you're saying that if the amputation does not occur, this infection can spread through the leg to the body, is it?
Yes,
Oh.
definitely. And it will get to the system, what called septicemia. The pressure might drop and the patient will get fever with chills, and mind you, now by the time they develop these things, as I told you, if you have a paresthesia or neuropathy, most probably that patient might go down with nephropathy, what called kidney problem,
Right.
or retinopathy. Their eyesight may be poor, right? Therefore, sometimes even these elderly people, that's why
Yes.
mostly they undergo amputation,
Yeah.
because sometimes even though they know that there's a problem, they can't see their vision is so poor. There's nobody to accompany him to the nearest doctor. So there are social implications as well.
I see.
So these are the things that. Other thing is sometimes footwear. Now we have come across very funny type of modified footwear that
Right.
they use.
Like sneakers and.
Because they are slippers, they just fall off.
Right.
They don't feel it, no.
Yes.
Of course.
Therefore, most of the time they walk bare. Although they wear the footwear during the daytime, at night they might not wear it,
Right.
particularly inside the house. But then that they are prone to very trivial infections or injuries rather.
Of course. So, Doctor, I think during your work, you have saved close to 500,000 people from and prevented them from having amputations. But there may be some inevitable cases. Now, you were touching on this earlier on in the conversation as well. Some inevitable causes where there is no other option except amputation.
Inevitable
what
causes
these?
are actually when the infection has spread too far above the ankle. We might not
Above
be
the
able to-
ankle?
yeah, we
I
might
see.
not be able to save it. Or particularly the most dangerous cases are the vasculopathy case, where they don't get blood supply. But we have very, very good vascular surgeons in Sri Lanka. If we detect the pulses, the leg pulses are low,
Yeah.
there are two major blood vessels supplying what we call dorsal species and the anterior posterior tibial, two arteries. Now, if a doctor, GP, detect that the pulse is low there, okay, unable to detect it, if the patient is referred to the vascular surgeon immediately, or for that matter any surgeon, right, he might be able to sort of do revascularization, maybe grafting or maybe a stenting.
I see.
So you can, there's no inevitable cases if you detect at early stage. inevitability comes only when you neglect it.
Of course. So actually, it's all about giving timely care.
Yeah.
But at the same time, how can you take the necessary steps to prevent these foot ulcers and prevent these injuries from taking place?
Yes, doctor.
Yeah, that is, you mean vascular injuries, is it?
Vascular
Foot
injury?
injuries.
All right, if you want to touch on that.
Yeah, no, actually we can test on vascular injuries, like there are specialized tests, what you call the ankle brachial index, where you can early detect whether there is any blockage of blood vessels on your foot. By undergoing these tests earlier, then we can assess the patient whether he is going to get a problem in the future, and warn the patient to go and consult a vascular surgeon. And of course the prevention methods are, of course, the patient should be wearing a proper wear of shoes or whatever the footwear. And the other thing is the awareness of his the neuropathy, the loss of sensation, that he should be aware about these things and be careful of what he is doing. So those are, of course, the
Certain occupation also put the patient to risk.
If you could elaborate.
It's a person who is a farmer, for instance.
Yes.
Of
A
course.
person who will work in a workshop with certain sharp instruments, right? Even a housewife sometimes, sometimes you might go, as Dr. Anurudh said, when you go to a place of worship, where you can, there are certain tiny objects where you can trample easily on. Right? So there are certain maybe mosquito coils, maybe sharp objects on the floor might injure your foot.
So
you have to be
depending
very-
on your occupation, you should
Yeah,
be extra
exactly.
careful about where you step and
Yeah, actually what we advise is, or if you have a insensitive foot, when you particularly go to a temple, right, you must always go at night, because sometimes the surfaces are maybe very warm. When you go around the pagoda worshipping it, sometime at the end of the day you might get a huge blisters around.
I see.
Then particularly you are travel on a motorbike, silencer, might touch your foot on a silencer, or maybe the bike is parked in a manner which is exposed to sunlight and it is very heated, warm, and you might accidentally put your foot there and travel, and by the time you reach your own home, your leg may be gone.
Right.
And those are trivial, that's why sometimes
Exactly.
you can't even imagine how these things happen.
Right.
And rat bites, they're very common. Sometimes you may come up with a bandage, with a discharge, that might attract cockroaches, rats, ants. So those are the other things. Sometimes we come across people who lose maybe all 5 toes eaten by rats. They don't wake up in the night.
Eaten, you mean like bit, or do you mean completely eaten off?
Completely eaten off.
That is deep. No one would actually think that it could go to that extent.
By the time they soak, they get a. The funny thing is that when the bed sheets are soaked,
Right.
so the ordinary person would feel the coldness,
Yeah.
but they don't feel that also.
Yeah.
So how can you detect?
True.
And if particularly if you put a booze and go to sleep, if something happens, you don't know until morning whatever happened to you.
The diabetics, go on.
Apart from the obvious reasons, Dr. Jarma, why is it important to save a diabetic foot?